Oftentimes, providers are concerned that they won't have enough time to administer the screening and an intervention, given the nature of primary care practices. Our screening is by definition brief, so a screening like the Columbia should only take several minutes. With intervention, you really have to take whatever time is necessary to keep the patient safe and get the patient linked to resources.
As Mark said, and as we will demonstrate, the Columbia is a relatively brief and important screening tool, and we recognize that primary care practices are constantly asked to integrate more screening tools, to track more data, to participate in more quality improvement practices. We also want to recognize the importance of zero suicide and the commitment of our partners in primary care to take this very seriously and to develop ways to intervene at the point of care in the medical home. I strongly recommend doing a PDSA cycle. From a quality improvement perspective, a PDSA cycle is plan, do, study, act. You could identify a small panel, for instance, as Mark said earlier, those patients with depression, those patients with a substance use disorder diagnosis, annual well visits. It's important to start somewhere. And we hope to demonstrate through this training today that it is possible. It is possible to start. We also want to affirm in many primary care practices in Chittenden County, there are social workers and mental health providers, either through the Blueprint for Health, and there are ways to get your front-end staff and medical assistants involved. We enjoy our collaboration through quality improvement projects with primary care, and we strongly encourage you to start somewhere.